some or other underlying medical disease. And these days, not only elderly, even the age group of 35 to 40, we have a lot of people who have cardiac diseases, who have a diabetes in the background, who are hypertensive, even the renal kidney disease, I mean the kidney diseases. So it's not only the patient who are elderly and with the diseases, it's the young people with the diseases gonna suffer with the severe disease and may have a bad or poor consequences as well. So elderly along with the people who are young with some kind of a disease in the background definitely need to be very careful. So if we talk about the symptoms, there's nothing much new to tell about these symptoms. Every year, every season change. A lot of us, especially in the north part of India where we have summers, winters, rainy season, we get the symptoms of dry cough, some fevers, gala kharab, sore throat. So loose stools, loose motions, body aches. Yeah, but few things are little particular about this. You don't get difficulty in breathing in any other normal viral diseases, which we get every year. Everyone gets it. You don't lose a lot of taste or a loss of taste or a smell. That's rare. It can happen, but it's more precise in this COVID-19. But none of these symptoms can define that this patient is having COVID. These are all a very common symptoms, can happen with any viral illness or other bacterial infections as well. So it's nothing peculiar that, yeah, I have a symptom, so this is definitely a COVID, or I don't have this symptom, so it's something else. No, you cannot deny that. Nobody can deny that. Nobody can confirm even. But these are the basic symptoms somebody can have, and they should definitely take a medical advice on this. So how does it spread? The worst part is its speed of contagiousness is too high. It makes such a bad chain that if you see the screen, a person in a red color is going to infect so many people in the right hand of the corner, that the chain becomes so long that it's become almost impossible to control it. So once we cannot cut off the chain in the beginning, then it's very tough to control or to cut the chain in the, when you get so many number of people. So the chain is an important part. If we cut the chain, if we don't, if we can stop this chain, that can definitely be helpful for all of our mankind. So how does a patient present to us? Pneumonia is very common. Most of the people, even with a mild disease, gets pneumonia in the lungs, and that is not a good thing. Reason being not a good thing is when your lungs are infected, you can have a disease severity, oxygen requirement, and even in the future, some part of the lung can remain damaged with this kind of a disease. So pneumonia being a very bad part or a bad sign or a symptom of this, I would say sign of disease, that shouldn't happen actually. Other is the cough, khansi, usually the dry one. Fever, it could be mild, it could be severe fever with chills. People can feel breathlessness. So around 10 to 20% of the confirmed patients have critical illness. So 10 to 20% in our population where we stand 1.3 billion is too high. So we don't want that 10 to 20% to happen, because as we all know that we have a second largest population in the world, and how to handle that, it's going to be very tough, and it is happening today. Normal lab tests tell us about this disease. It's just a nasal swab, earbud or a bud kind of a thing, which just take a sample and you can get the report in few hours. Then if you have a phlegm or a sputum, that can also be helpful in detecting the virus. So that is how we detect and confirm the disease. So that was about some part of the COVID-19 or the coronavirus, and some of them symptoms, how the patient can present, how a person can have those symptoms, and what about the chain, how it gets transmitted. So now further, obviously, I'm not going to talk about any kind of a treatment of the drugs. We have few drugs, and we have been managing these people with these drugs, and they definitely have a good role. I wouldn't say that they are not working at all. They have a good role. We have been treating at least more than 200 patients from the last 1.5 to 2 months, because the speed has, or the number has increased in the last few weeks a lot more. So what are the precautionaries and the advisories for people who are not into the medical field? Those are not treating those people. Those are not the direct contact